Welcome to an Internet Town Hall with State Senator Holly Mitchell. Tonight's topic, the Affordable Care Act. Joining the Senator on tonight's program is Peter V. Lee, Executive Director of Covered California. Now, live from Sacramento, here's the moderator for tonight's Town Hall, Brian Green.
Well, hello everyone, and welcome to our live Town Hall. Well, access to health care in America as we know it, and in particular access to health care in California as we know it, changed on October 1st of 2013 when President Obama's Patient Protection and Affordable Care Act, or as it's known colloquially around here, Obamacare, became law across the country, rearranging the health coverage landscape with the creation of the so-called health insurance exchanges that chose to participate in this new health care coverage marketplace. And one of the states, of course, that's chosen to participate in this change in the health insurance and healthcare marketplace is our own state of California. And our own state exchange, Covered California, came online on October 1st of last year, along with the federal program, and hasn't looked back. Well, here we are in March of 2014, and the deadline is coming up for the end of this month for enrollment in the Affordable Care Act. And Covered California continues to work to rise above the tide of politics and bureaucracy and angry healthcare debate to enroll as many Californians as possible. And this hour, we're going to talk to one of California's distinguished state senators who's doing her part to make as many Californians as possible understand easily and get involved in the marketplace and enrollment process, find care where it's desperately needed, perhaps tweak the Affordable Care Act and the legislation legislatively. And also, we will have with us the director of the Covered California Exchange himself, get his perspective. And we want your input and questions as well about this change in the healthcare landscape that has not come easily.
Any look back at the headlines of the last 6 months will remind you of the near disastrous rollout nationally of the Affordable Care Act, with unbelievable stories of computer software glitches, health plan cancellations, and a nation of consumers more confused and frustrated than ever about the access and affordability of their health plans and the viability of this grand plan called Obamacare. But California consumers were held harmless from most of the worst aspects of the Affordable Health Care Act transition, thanks to the creation of our own statewide healthcare exchange, Covered California. Some sources say Covered California's more user-friendly software, complemented by a user-friendly marketing campaign, are prompting about 8,000 people a day to enroll in the state's health exchange program, which exceeds Covered California's original estimated enrollment and is well ahead, by comparison, of the enrollment figures of the federal Affordable Care Act exchange and those of the other state exchanges. But as the March 31st, 2014 open enrollment deadline nears, Covered California still faces challenges in the Golden State healthcare marketplace that reflect the challenges faced by the federal mandate. Millions of Californians are still uninsured, and reports say the exchange has fallen short in certain regions of the state, like Riverside and Fresno, and has fallen short with key constituencies that the Affordable Care Act needs to remain viable, in particular those in the Latino community, and all of those healthy young Californians who plan to live forever and who have been chased away by the seeming complexity and inconsistency of the healthcare enrollment and access process. But with the investment of a new multi-million-dollar enrollment ad campaign and what some would call a refreshing transparency and humility about the challenges it faces in trying to increase healthcare enrollment, making enrollment easy and accessible, and restoring the trust of thousands of Californians who saw the poor rollout of the national program or who had their existing policies canceled outright in the process, Covered California is looking at the challenges and opportunities ahead in 2014 as it works to meet the original mandate of the federal Affordable Care Act, providing accessible health care even to many who have never had it or who can't afford it.
And joining us for this conversation to talk about the Affordable Care Act and Covered California, our State Senator Holly Mitchell, representing the 26th Senate District in Los Angeles, one of our newest state senators who came to the upper house last fall after serving in the State Assembly. She's also chair of the Legislative Black Caucus and has a distinguished portfolio in and out of public service as an advocate for quality health care and family-focused policymaking. And I know you have been having a lot of hearings even back in the Assembly before October 1st of last year, getting California ready for the Affordable Care Act. So welcome. Glad to have you, Senator.
Thank you very much. I'm really pleased to be here today to have this conversation with constituents and Mr. Lee to answer some questions and continue to promote the importance of the Affordable Care Act.
And indeed, Peter V. Lee is the Executive Director of Covered California Benefit Exchange since 2011, and he came to California with a background in federal healthcare leadership and policy implementations. Mr. Lee, welcome. Thank you for joining us, too.
Great to be with you, and great to be with Senator Mitchell, who's been a real leader, making sure people actually do get enrolled. So.
Great. Well, glad to have you both. There's so much we can talk about. We also want to encourage you, the viewers, to participate. We've had some emails that have come in over the last few days that we'll be getting to as soon as possible. But as you watch this program, if you are prompted by anything discussed or anything debated here, to ask a question or send in a comment, we invite you right below the screen. There's a prompt for you to enter your name and your location, write in your question, hit submit. We'll get to as many questions as we can from the viewers through the body of the program. Well, let's start with both of you. I know looking back over the last 6 years, I'll start with you, Mr. Lee. You have had quite an incredible, extraordinary time since October 1st and before. Tell us, just give us some of the perspective of all the things that have gone on in the national level and here in the state, the problems with the Affordable Care Act, a lot of opportunities, a lot of changes, a lot of concerns. Give us kind of a look back and a perspective on the last 6 months or so.
Yeah, I guess, well, the main thing I'd say, looking back and looking forward, is for us all to recognize how incredibly historic this is. This is the first time we as a nation are saying healthcare is a right, not a privilege. It is by far the biggest change since we implemented Medicare 50 years ago. And in that context, we've had some bumps along the way, but here in California, we've done a really good job getting literally hundreds and hundreds of thousands of Californians that previously did not have access to healthcare because they couldn't afford it, now insured. And that's really been very exciting. And we've seen people in every community of the state saying, let's make this thing work. Let's not play politics with the Californians that need health insurance. Let's get it online, let's get it working, get people enrolled. And that's the main thing that I've been excited by over the last 6 months. And
I know, in fact, today you even released some updated figures, and there's, depending on which website or which source you go to, the figures are sort of vary and are kind of wild. But what's the latest as of today? You're approaching 1 million, right?
Well, actually, there's a couple of numbers that's really important. Often, Covered California, when you go to coveredca.com, which I want everyone that's watching this show and listening to get online, send their friends, send their families, they need to enroll, but it's not just to enroll in the Covered California product where you get a financial help to pick the private plan, it's also to enroll in Medi-Cal. And we need to look at that whole number. And so there's well over 2 million Californians now have Medi-Cal that wouldn't have but for the Affordable Care Act, or have enrolled and got financial help to get a private plan through Covered California. 2 million Californians. That's a lot of people that have health care that wouldn't have that except for the Affordable Care Act being implemented here in California.
I wanted to ask you that question first, but I wanted to talk now to the Senator, just get your reaction to what Mr. Lee has said, based on what you have dealt with over the last several months, in fact, the last couple of years, as the build-up to the implementation of the Affordable Care Act has come about. You've dealt with the delays, you've dealt with people's concerns, plans being canceled despite the earlier promises. There's been education and training, kind of fighting against the bad rap and the conventional wisdom that this was kind of a disaster. And then, of course, balancing that with the hope that this just might work and that you might actually see constituents in particular getting care that they haven't had otherwise. Give us some of your perspective on that. And I know for you, in fact, have challenged Mr. Lee in the past to say, you know, is he going to be able to walk the talk? Here we are, fast forward to March. What do you think?
Well, I view the rollout here in California, Covered California, from a glass half full perspective. I think it's unfortunate that every time we begin a conversation about Covered California, the Affordable Care Act, we start with all the negatives. Moving 2 million people into anything, into any new system, to build a system with the capacity to manage that number of people is an overwhelming undertaking. And so if we were naive enough to think that it was going to be flawless, people were going to be enrolled without any hiccups, then we were naive. Yes, there have been challenges, but the point with challenges is really making sure that we have access to the decision makers, and that we've seen movement and seen improvement. And I believe, on par, we can all say that. Yes, I agree with many of my colleagues in the legislature who are concerned about the enrollment numbers for the Latino community, but I do hearken back to our experience of enrolling new eligible individuals into any new program. Healthy Families, 15 years or so ago now, we had the exact same situation where there was expectation based on eligibility, but the enrollment numbers were slow. And so what I said to Covered California over the past several months is, let's be sure that we learn from our past experiences. And what was evidenced by that was the whole application assistance process, where we actually had places where people could go in their community to get help, not just to assume that everyone would be savvy enough, have internet access, and be able to navigate online enrollment, but to also come into the communities and offer assistance. So again, from my perspective, glass is half full. As a legislator, as the former budget chair for Assembly Budget Subcommittee number 1 in Health and Human Services, recognizing the savings to the state, frankly, of those 2 million individuals having a health home, having access to a health insurance product, and therefore having access to providers, has saved us not only dollars, but in terms of human capital, people having a place where they can go get health care as opposed to the kind of episodic experience of going to the emergency room. I think making sure that we've opened up the provider pool to include the community clinics and other community-based providers was really smart and strategic. And for all those reasons, I feel really good about what our experience has been thus far.
So you feel it's an inherently good thing then, right?
It absolutely is. And again, for us to think that it was going to be without hiccups was naive on our part. Moving 2 million people into any new system is a challenge.
Mr. Lee, obviously you would be derelict in your duty if you answered no to that question, but why is it an inherently good thing,
Well,
considering what you've said up to this point here?
One of the things that Senator Mitchell said that I think is so important is that this isn't just about insurance. It's about getting people access to health care. And that's what this is about. This isn't about 2 million insurance cards. It's about 2 million people getting, to use the term, a health home. 2 million people getting access to free preventive care, which the Affordable Care Act provides. It's 2 million people having regular continuity relationship with a doctor, so they have a whole new peace of mind. And that really is historic. I mean, this is where I often pause and look back at Medicare. We could not imagine today being in a world when our grandparents or parents, depending on our age, wouldn't have Medicare. We wouldn't imagine it. And I look forward to the day when we can look back on now and say, we had a day when every American didn't have health care? Well, what's with that? And so, I actually am similar. It's the glass isn't flowing over, but the glass is more than half full. 2 million people are well on the way, actually, to delivering on a promise that we've waited a long time to get.
Well, we will definitely talk about some of the elements of that glass half full in the body of this hour. Let's first, though, talk about a deadline that's coming up that's important nationally as well as here in California. A couple of deadlines that you and the nation are facing. There's one on March 15th, which I guess is the last day for purchasing a policy that would start in April. But then the key date is March 31st, which is the deadline for enrollment. Do you want to give us some details on that?
Yeah, so this next week, the 15th, is the deadline. If you don't sign up by then, your coverage can't take effect on April 1st. But open enrollment, which started October 1, goes till the end of March. Now, if you don't sign up by March 31st and you're uninsured after that and you're eligible to get coverage, you're going to pay a penalty. Now, the penalty is not very big, 1% of your income. So if you make $30,000, the penalty would be $300. But the big penalty we want to make sure people avoid is ending up in an emergency room next June and walking out with a $200,000 debt. The penalty we want people to avoid is missing that preventive visit, which means they stay healthy. And so this March 31st is the period when you can get that financial leg up to make healthcare affordable. It's also the period where health plans can't turn you away because of pre-existing conditions. After March 31st, you'll need to wait till the next open enrollment period, which is next fall, which is going to be next November. So we want people to get the word out. Tell their friends, tell their family, tell people in their church, in their school, where they work, that we all have friends and family that have been going without a health insurance. Now's the time to get them to step up.
That relatively small penalty actually has sort of been a disincentive, particularly for young people, to sign up. Well, it's worth paying the penalty just so I don't have to deal with all of this. What's your response to that?
That's actually not true. I mean, we've actually done a lot of surveying, and when you do focus groups and surveying of young people, their question isn't about the penalty. It's they want to make sure it's affordable. And when they realize how big the subsidies are, they're saying, oh, okay, for me, given how much money I make and given the financial support, this is actually less than my cell phone bill. So the issue isn't about penalty. No one is sitting on the sidelines because of a penalty. People that don't have insurance in California today don't have insurance because they don't think they can afford it. It's a new day. They can afford it because of the financial leg up, or for many, because they're now newly eligible for Medi-Cal.
We'll go to the emails here in just a moment, but Senator, any perspective on that? Have you heard some of those similar concerns or similar feelings that Mr. Lee has echoed through this?
I have, and quite frankly, it's the vast majority of the people who've expressed those concerns to me are people who have not gone online and gone through the process to actually find out, given their unique set of circumstances, what the cost would be to them. To be perfectly honest, it's based on hearsay, what my coworker said, what my neighbor said the cost would be to them. I can't say that I've heard it from individuals who've actually taken the first step to go through the process, which is a multi-step process. You have to enter a lot of personal data to come up with the golden number in terms of what applies to you. I have heard the reverse. One thing I love about being an elected official is when I'm in my home district in the community, people recognize me, come up and engage me in these kind of conversations. I'm sitting having a plate of barbecue in Culver City at my favorite spot, and the proprietor, who had a pre-existing condition, talked about going and enrolling himself, his new wife, and I was frankly amazed at the cost savings in terms of, because he had had a pre-existing condition, what this was saving him. And so I'm also hearing stories about people having wonderful experiences, not only getting insurance for the first time, but cost savings.
Right.
If I could,
yes.
One of the things the Senator said a moment ago, which I think is really important, is people can find local help near them. And you can actually go on our website, coverageca.com, and enter in 3 pieces of information. That's it. How old you are, what your income is, and how big your family is, and your zip code. 4 pieces. And it'll tell you within 2 seconds if you're eligible for a subsidy, what your plans are. So you can find out that golden ticket really quick. But if you don't understand insurance well, you can also go to that website, coverageca.com, and say, find help near me. Put in your zip code, and you can find dozens of people in Culver City, licensed insurance agents, certified to help you, certified enrollment counselors in community groups, at community clinics. Call them up, get an appointment, sit across the table and say, how's this work for me?
Our first question here is from Kimberly from Los Angeles, and speaking of costs of coverage, she wants to know what will be the cost of coverage through Covered California. And I suppose that depends on a lot of variables. So give us some details.
It does. I mean, it is one of those it depends issues, and it depends on how it works is basically the financial support is sliding scale. You make less money, you get more financial help. So you make, if you're a single person that makes less than $15,000 a year, you're now eligible for Medi-Cal. Bam, that's it. There's no asset test, there's no complicated things, it's just an income test and that's it, which basically means it's free. You make more than that, you make a little bit more, you make $17,000, you're going to have virtually all of your premium paid for. You pick the private plan that you want, and in LA, you got 6 health plans to choose, but it's your choice. You get financial support that would mean you might be paying as little as $20 a month for your premium. You make more money, you make $60,000 a year, you might be paying a couple $100. It depends on what you want to choose, how rich the benefits are, and the financial support that is going to be big if you make less money, less big you make more money.
Go ahead,
And
yes.
I'm just going to add to that, I think the critical piece that Kimberly needs to take into consideration, we don't know Kimberly's particular situation, but at no point in those 4 questions do you ask me if I've had a pre-existing condition.
Absolutely right.
And that's a key,
And that
very
is
key element
critical
of this. Yes.
for the hundreds of thousands who were locked out of and couldn't afford access to health insurance because they did have a pre-existing condition. When you consider the number of people who in our current economy may have lost employment, couldn't afford COBRA, had a pre-existing condition which would ratchet up the cost of a new plan, that is fundamental, and I think it's been a game changer for healthcare delivery system.
Well, you mentioned the number of healthcare providers that are out there that are part of this marketplace, particularly for Los Angeles. Is the marketplace competitive enough? Is California getting the best bang for its buck in terms of healthcare? And part of the reason why I ask that is there are so many choices being offered, depending on whether you do a platinum plan or a bronze plan or what of that. the quality of health care can vary. Is there a minimum level of adequacy, quality of health care that Covered California insists on with these providers that provide this service in the marketplace?
So a couple of things. So Covered California, when we were founded, so you noted that we as a state said, we're going to make the Affordable Care Act work for Californians. And we're going to have Covered California, which I serve a 5-member board, which says we're going to pick health plans that provide quality and provide good value. We didn't take all the health plans. We were picky. Across the state, there's 11 health plans participating, different by region. LA has more than any other part of the state, 6 health plans to choose from. But what we also said was, let's not let health insurance plan play games. There's different levels of benefits. So if you want to spend a lot of money and spend a little tiny bit out of pocket, that's a platinum plan. Silver plan means you spend a lot less in premium, but you get a pretty good, that covers a lot of your care when you go see the doctor. But all the plans of the silver plan are the same benefit design. So when you're deciding between Blue Shield and Health Net and Anthem and LA Care and Kaiser, Molina, you're picking the plan because it's got the right network of doctors for you, and not because they're playing games with the benefit design. So every one of the plans that we've selected has a good network of doctors and hospitals, and you need to do some research to see if you've got a particular doctor that you've had a relationship with, check the directory that we've got on our website to see if they're in the plan you're going to pick, but every one is providing great quality care.
Let's go back to the emails. James from Los Angeles asks, what kind of documentation do I need to enroll? We have some very specific questions, but these are important questions for people who are looking at this deadline, sitting down at the computer and ready to take the leap here. So give us some of the details about documentation.
Yeah, it's really pretty simple. You need your information on where you live. You need information on your income, so your W-2 or your tax filing, information on your immigration status. That's pretty much it. And when you've got that information, you put that in the application. You can get in and out in 30 minutes. Now, if you've got a big family, it might take you a little bit longer, but it doesn't take that long. The issue that may take a little while, though, is to understand insurance. That gets complicated because, insurance is still, we've done a lot to make it as simple as possible, but it's still kind of confusing. What's a copay? Which is the right design for me? Which is, again, why I think take those pieces of information, grab your driver's license, take your last year's taxes or your W-2, go meet with someone in your community. Let them help you out. It won't cost you a penny. And they have to keep everything you talk to them about totally confidential, including immigration status. And this is actually important because we've actually found in the Latino community, many families might have some members of the family who are not documented and other members who are documented, who are legal residents. People are worried about sharing that information. That's going to be used for one purpose and one purpose only, to help that family get health care. It's kept totally confidential by those people that help people enroll.
And of course, you bring up immigrant health care, and that's been a key issue, one of the key concerns that has been pushed back to you at Covered California. And I know, Senator, you will have some comment on this too. And some of the senator's colleagues have even come out to you saying, particularly in the Latino community, the services, the access to the websites have been poor, that there's a key constituency, if you will, that is not being reached in this. Now, I know you've doubled your efforts. What's the progress been on that particular case? And what have you seen from the district level and the constituents? But let me get your answer to that, Mr.
Well, let me actually answer 2 questions, if I could. First,
sure.
Issues of undocumented. One of the things that we as a nation need to address far better is not discriminating. The Federal Affordable Care Act says coverage will not be provided on the Affordable Care Act undocumented. And I know the California legislature is looking at this issue. The Congress should look at it. That's a key question. So that's one track. The other track, though, is making sure that we have everyone enrolled. The Latino community is about 40% of those who are eligible for subsidies in Covered California. And, we aren't hitting that in terms of the numbers of people that are enrolling. From day one, we had material in multiple languages, including Spanish. And from day one, we had community groups anchored in the Latino community doing outreach in the community. With that, we've done a better job over time. But the key piece, I think, really is insurance is confusing. We need to get people talking to people in their community. We now have thousands of Spanish-speaking certified enrollment counselors and agents in every part of the state. And we think that's going to make the difference going forward.
I know that one of the concerns was about that there were certain parts of the state, as we mentioned in the video, about Riverside and other parts of the community that didn't seem to be having the imprint or the impression from the Covered California outreach as other parts of the state. Has that been resolved as well?
Well, by resolve, and one of it's relative, is we as a state are doing really well. Some parts of the state are going way past the projections. That some areas, in particular those that have more Latinos, and we also aren't doing as well as we want to in the African American community, it's a relative question. It's because we're doing so well overall as a state that we've got 2 million Californians in Medi-Cal and in Covered California, but we want the entire state. We don't want to leave anyone behind. And so that's why we're out there in community papers, in churches and schools across the state to say, you know, if we aren't doing so well in Riverside, let's double down. Let's spend more effort out there, same in the Central Valley, and make sure we get everyone in.
Senator Mitchell, what's your response on that? You obviously have seen this at the district level and the concerns that you and your colleagues have expressed to Covered California and expressed statewide about the outreach or lack of to certain constituencies.
I think it was not only outreach, but also there was a lag in terms of really being able to gear up quick enough to have enough certified application assisters out there across the state in the sheer numbers to be able to hit the ground running and hit it fast, if you will. And so, you know, we reached out to Mr. Lee and talked about we've got to break that kind of funnel that has occurred to make sure that we have enough application assisters out there. And like I mentioned earlier, I think it mirrors our experience on the healthcare side with healthy families. It was primarily Latino and African American families who we knew would qualify, those who earned too much to qualify for Medi-Cal, but not enough to then afford health care insurance, or they didn't have employer-based. And the uptick was slow. I think that we have culturally a lot of work to do to make sure that people are comfortable and confident in the product that's being sold to them. That's the reality. It's a new product. For many, it's a new concept. Immigration status. There are a number of issues that can create this state of fear about something new, something that I don't have history with, something that I can't go to a friend or neighbor or talk to them about their experience with because it's brand new. That's why members of the Legislative Latino Caucus and the Black Caucus have been very clear and have gone out into our communities to talk about why it's important to enroll and to enroll quickly. We've taken upon ourselves as community leaders to partner with many of our community institutions to be the face of this new product and talk about why it's so important to the health and well-being of our communities. And so the partnership is important, but you know, it's a new model, and you know, communities, historically disenfranchised communities in many instances, have good cause and have really negative experiences with new government programs. And I understand that fundamentally it's our collective responsibility to try to dispel some of those myths and talk about what the Affordable Care Act can do for you and your family.
Well, talking about a disenfranchised community, one in particular that's come up particularly is the undocumented persons here in California, and Mr. Lee mentioned that. And your colleague, Senator Lara, has authored legislation that would expand this kind of coverage to undocumented persons. I think there's about 2.6 million people that this would affect. Some say this is very visionary. How do you think this would work? You support this, obviously, and get Mr. Lee's reaction to this as well.
I absolutely support it. And agree. I think it's the California Endowment who has this wonderful PR campaign that says, you know, health care for all, really all of us. And I completely agree. I fundamentally believe, as a legislator, as a Californian, that we are all entitled. Access to health care services is a fundamental right. And so making sure that all California residents, everyone who's here, has access. What I try to do in the meantime, in our last budget cycle and the one before that, when we knew Affordable Care Act was coming out, the administration suggested that we pare back some of our funding and some of our state-only programs. And we didn't let that happen because we knew that some of our state-only programs, meaning state-only dollars, are in specific carved-out programs that are heavily utilized by undocumented residents. So we wanted to make sure that we didn't kind of cut our legs off from under ourselves, assuming that the Affordable Care Act was going to solve all of our uninsured problems, and it really isn't. There's a segment of the population that currently is not entitled to that program. As a California legislator, I'm going to do all that I can to make sure that there are adequate funding at the county healthcare system and some of those special healthcare programs, some of the maternal and child health programs, to make sure that every resident has access to the services that I believe, again, that they're entitled to.
Well, we are talking to State Senator Holly Mitchell, representing the 26th Senate District in Los Angeles, and Peter Lee, the Executive Director of the Covered California Benefit Exchange. And we want your emails as well. Right below this screen where you're watching, there's a prompt to enter your name and your location and your question. Put it in, type it, hit send. We'll get to as many emails as we can. In fact, let's get to one from Cleo from LA. She asks, how will Covered California provide healthcare enrollment for the homeless citizens of California? There's another constituency.
Absolutely.
It's a great question. So we're actually working, on the ground with community organizations across the state. Examples like community clinics. I mean, these are places where people go today. And that's where we start, is to make sure that those trusted voices, and we're working with churches, et cetera. The thing that I note for many of the homeless, they're pretty likely not to be eligible for Covered California, that financially, but for Medi-Cal. And this is why we have been partnering so closely with the Department of Healthcare Services. We want everyone to be insured. And so those are some of the outreach avenues. I would note, if I could follow up on the Senator's last note, is, the Affordable Care Act is going to go a long way, but it's not the answer to everything. We still need a safety net. The role of community clinics in particular, I'd call it, in public hospitals, so vital and needs to be supported, because we're going to enroll a lot of people between now and March 31st, but this is going to be a multi-year effort. Just as we saw, 15 years ago when the Healthy Families Program took a while to gear up. We're at a starting line. It's going to take a while to gear up, to get people to understand what this is, so we need to make sure we continue to support a rich and vibrant safety net for those that aren't insured.
Agreed.
Right. Next question is Sydney from Los Angeles. What happens if I enroll now into Covered California and my income changes at a later date? Will my premium go up?
That's a really great question. Well, now, Sydney, I hate to tell you, your income could go down as well, or up. So the thing you should know is that your subsidy that you get is based on your income. And we're going to be reminding people, if your income changes significantly, you come back to Covered California, make the adjustments, and then your premium might go up or down because you can get more financial help. At the end of the year, when you file your taxes for 2014, you're going to potentially get a credit back if you've actually, income's gone down, you deserve some money back, or you might owe a little bit. But we want to make sure people understand what their obligations are, so they take that credit and use it wisely. Now, you can say, I don't want to have that reduced premium each month. I'll take it all in a lump sum at the end of the year. Most of us can't afford to do that. So that's why we're going to help people change their subsidy level throughout the year at any time their income changes.
And I assume marital status as well, that would be affected in this? Okay.
I mean, a couple things. We talked about this open enrollment period. It ends on March 31st. But enrollment doesn't stop then, for a couple reasons. First, Medi-Cal does not have an open enrollment period. So if you're very low income, you can sign up throughout the year. One. Number two, if your life status changes, you lose your job, come on down. You lose your job, you can get the financial help through Covered California, guaranteed issue from a health plan. You get married, you get divorced, your life changes. Covered California is going to be open for you. But if your life doesn't change, you're in the same situation you were today in 3 months, then, sorry, the door's going to be closed.
I assume, Senator, this mirrors some of the questions and concerns you've received in all of your workshops and all of your meetings in your district regarding this issue.
Absolutely. Going back to the question with regard to the homeless, we spend a lot of time talking about Covered California, as we should, but recognizing the impact, the expansion of the Medi-Cal program, opening up Medi-Cal to basically childless adults, is equally as significant.
Huge.
And so that's where we've created the opportunity. And the Affordable Care Act gave us incredible opportunities. I carried a bill establishing health homes, targeting the homeless population, targeting those with chronic health conditions. And when you're homeless, you may not have the opportunity to manage your medications well. And so to create a wraparound health home system that will help the homeless population manage their health care, will also reduce costs significantly outside of frequent ER use, but just to help people manage their chronic health conditions. So it also improves health outcomes. So the homeless population is one that certainly is going to benefit significantly. And again, partnering with a number of the community-based organizations that support that population has been critical and key.
Yeah.
Okay. Let's go back to the emails. Kenyon from Los Angeles asks, how can we continue to push forward to make sure no one is left without health care coverage? Well, that right there is the key issue, the key theme of everything you're doing here in California, but some specific response to Kenyon.
Well, I think some of the things that can be done are legislative, and the senators talked about some of these. What we need to do, though, this is really, I mean, one of the things we're really excited, we've started doing outreach with Dolores Huerta, you know, who with Cesar Chavez, you know, United Farm Workers, and one of the things she said, which I love the expression, is that we all need to be organizers. Is that this isn't about Sacramento, it's not about Washington, it's about what happens in Culver City, it's what happens in Inglewood, what happens, you know, in throughout the state. We need to be reaching out to our friends and family. So the number one thing that I'd say to people that are watching this is don't look to us to do it all. We need to do it in our church, in our schools, and the way we're going to make sure no one's left behind is that we take that initiative to reach out reach out to all your friends on Facebook, because all of us have family members and friends who don't have insurance. So I'd say it's all of our job.
Senator Holly Mitchell and Peter Lee from Covered California are here talking about this issue. We encourage you to send in your emails for the time we have left. Feel free to write in your question and your name and location and hit send. We'll get to as many as we can here. Zach Galifianakis interviewed President Obama today on his crazy little cable program. Sorry, you guys, you're stuck with me instead. But
we're our first.
Yeah. Well, you know, there's still a lot of rumors. There's still a lot of concerns about this. I mean, just as an example, Zach Galifianakis, when the president started talking about the Affordable Health Care Act, he said, "Oh yeah, this thing that doesn't work." So he's being glib about this, but you're still dealing with this impression left over from last year, the end of the fall, that things just aren't working. How are you, as a legislator, you as the director of this California program, dealing with that image and pushing beyond it so it becomes a glass more than half full?
You know, as a legislator, it's a rare occurrence when a constituent calls and says, "I'm just calling to tell you you're doing a great job, and I support you." My role as a legislator in supporting my constituents and making sure they have access to state services, many of which they're entitled to, is to help them navigate through the challenges and the bureaucracy. That's really kind of the function of our district offices, and when I encounter constituents, that's the lion's share of the issue. And so this is not unique. We get calls around challenges with the DMV, Employment Development Department, any new major program rollout. I get that. I also, I think, get a little defensive when folks want to challenge and question the appropriateness of covering who Covered California covers. And so we've had to break through some of the isms and some of the bias. I think some of the bias that this president and the Congress who passed it encountered as well. So we have to cut through some of that. Again, I go back to, I believe access to health care is a fundamental right. If you disagree with me, then we're clear. But if you agree with me, let's talk about what it takes to provide that. What it takes to move 2 million people into any kind of system, a government-sponsored system or otherwise. That's a phenomenal undertaking. And so I think that it's got a bad rap. I get that. We need to talk openly and honestly about why it's gotten the bad rap, what isms are involved in that, move beyond it and talk about every Californian should have access to critical healthcare services before you need them and certainly when you need them. We've talked about the challenges young adults are experiencing when they're prioritizing their lives. However, I've heard from a number of parents of young adults who say, what a relief. I can carry them through the age 26. You know, what a relief to know that I don't have to be concerned about my young adult who's trying to pay off college debt, get out there on their own with their first jobs and their ability to afford health insurance. It takes some of the pressure off and will help create the culture shift that we've got to create as a state and a nation around our attitude around access to healthcare services.
Well, Mr. Lee, let's talk about your reaction to what I had asked and the culture shift and the isms. I guess we should not be surprised that people are going to be out there wondering who's entitled and who is not.
Exactly.
What's your reaction to that?
Well, a couple things. I mean, first, some people around the nation have been trying to undercut the Affordable Care Act for the last 3 years. There's been a campaign of disinformation and misinformation. And what I look at is, here in California, this has not been a political football. Now, we get a lot of national news. So the national news has been about glitches and websites. And people are thinking, oh, the California website's working okay, what's the issue here? But the national news is still focused on a lot of the nation, which is still fighting over something that's done. You know, it's passed into law, upheld by the Supreme Court, president reelected. This is the law of the land. And the thing that I look to is, and we've had hiccups along the way of the website not being perfect, but it being pretty darn good. What we've seen in California, and the reason I think we see 2 million Californians that have health insurance because of it, is every part of the state, licensed insurance agents, doctors, health plans, community clinics, chambers of commerce, saying, let's not play politics. Let's make this work for Californians. And that's why I think by and large it's working.
Let's go to another email. Mary from Culver City asks, as a healthy young adult, what benefits are there to me enrolling in Covered California? I mean, this is, again, something we hit on earlier, but every young person out there who, like we said in the video, is going to live forever, is not ill, doesn't get ill that often. What's to prompt them, what's them to attract them to this Covered California and this process?
Yeah. I'd say there's two things. Is one, you get some benefits that everyone needs. Preventive services, free, without paying $1 to go see the doctor for preventive services. You get the knowledge of knowing you can go see a doctor if you need to, and it costs very, very little. And depends on your income, it can be literally a $3 office visit. That's one. The other thing you get is peace of mind. Because now insurance is a concept. Insurance isn't about getting back every day what you pay in. It's to protect you in case something bad happens. Now, I hear all too often of people who say, you know, I wasn't insured, I couldn't get insurance, and I am now carrying a $200,000 debt, literally. That's the sort of thing I want no young person that's like struggling with going through school to all of a sudden be in the hospital and walking out with a huge debt. You never know what's going to happen tomorrow. No one is invincible.
Yeah, can I talk to Mary directly?
Sure.
You know, Mary, I too was once a young adult. A sense of being invincible. How quickly that passes, Peter. But when I think about a number of statistics, I was meeting with a representative from the city of Los Angeles today, talking about a piece of legislation that talked about hit and run accidents. 40% of accidents in the city of Los Angeles are hit and run. When you think about unintended accidents, that's an accident is unintended. To say that I'm a healthy young adult and assume that that will forever be your status is just naive. Culver City is neighbors city of Los Angeles. There are any number of things that can happen to Mary that could change her life in an instant. A part of the culture shift that I think that we have to help manage is recognizing that we've got to be proactive around our health, around preventable health, and just be conscious of incorporating access to healthcare services into our budgets, into our psyche, into our lives.
Right.
Mary, you just got to do it. It's a part of growing up.
There's that advice, Mary. Thank you very much, Senator. John from Los Angeles asks, if I sign up for Covered California, how do I avoid losing my current doctor? This, again, hits one of the key concerns, one of the key, you could even say wives' tales, one of the key fears of Covered California, the Affordable Care Act, people losing their doctors, losing their current plans. What do you have to say?
So a couple of things. One of the things, when you go to coveredca.com and you're going through the selection process, at each health plan, you can click on a link to see what are the doctors in that plan. Now, every plan does not have every doctor. That's not how health insurance works. Each health insurer has different networks of doctors and hospitals, but you could search and find out and talk to your doctor, see which health plans he or she contracts with. Now, there are some doctors that have said, I only want to be in the super platinum plan. But every one of our health plans has a wide range of doctors that are primary care, specialists in every kind of specialty, and you'll be able to find a doctor for you.
One of the key, I guess you could say that the most difficult parts of this rollout from October was those with current policies starting to lose those policies after being promised that they wouldn't have to. The Obama administration scrambled, and now there's a policy that's just been announced adding an extra year, now making it 2 years where you can keep your policy. And I know that on the federal level and the state level, we're dealing with this. How is California affected by this? Some states, some insurance commissioners are not allowing the insurance companies to do this, and they're just moving forward. Where does California stand?
Well, California actually in state law said that the benefits of having the full coverage of Affordable Care Act coverage, which is going to be there when you need it, which covers all essential benefits, which has preventive care as a free service, is something we wanted to make sure all Californians had. So under state law, that conversion happens this year. Now, we've actually made that conversion. It's already happened. It's already shifted. So people in California have already converted to the Affordable Care Act products. There are people, because the Affordable Care Act says if you had a plan that prior to 2010, it's what's called grandfathered, those are still grandfathered plans. Those keep on going. So we've already made that conversion. It's sort of a moot point here in California.
Senator, any comment on that? Obviously, you've heard that from folks, constituents, who all of a sudden have this plan. They go into the Affordable Care Act, and all of a sudden they've lost this plan, and they're in limbo.
We have received some calls, and quite frankly, we have reached out to folks in Peter's office who've been able to offer some assistance and provide some clarification. I can't say that that's been the lion's share of the inquiries we've gotten, quite frankly. I think those folks were able to navigate the system and get their answers. The lion's share of the questions that we receive really are many of the questions that we've heard here today. How do I get access? Why should I? How do I keep my doctor? Some of those basic, fundamental, really kind of health insurance product questions that people pose generally.
Yeah. And if I could, the issues of people that had insurance, 900,000 people had insurance that got to keep insurance and got to pick any private plan. And for many, prices went down. For some, prices stayed the same. For some, prices went up a little bit. And this is one of the issues I think that Congress needs to look at, how to have the Affordable Care Act work better for everyone. Mm-hmm. Because the subsidies work with a hard stop. You make 400% of poverty, which is a lot of money. It's $92,000 for a family of 4. You make more than that, you get no subsidy. Okay, well, for some people that are older, depending on where they live in the state, insurance can still cost quite a bit. Mm-hmm. The Affordable Care Act has not made health care in America inexpensive. Mm-hmm. Mm-hmm. What it's done is provide financial support to make it more affordable. So Congress needs to wrestle with some of these issues over time. We should improve a law that's changing history. And it's going to be a building process.
I want to get your final thoughts on this as we wrap up, but I also want to touch on first on the business community. There's been a lot of the fears that the Affordable Care Act and this marketplace and this exchange is going to prompt businesses to stop hiring full-time so they have an excuse to not provide health care. How's your relationship with the business community moving forward?
It's been really good. I mean, one of the things, again, we've seen here in California, both small business, the chambers of commerce, we do events with chambers of commerce, both general chambers, but some of the ethnic chambers across the state, reaching out to members of their community, the business community, saying, we do better if we have our employees healthy, which means them having insurance is the right thing. Now, I know for many small businesses, those that have which are sort of the engine of the economy, those with less than 10 employees, many of them can't afford health insurance. Many of their employees are now coming to Covered California, the marketplace, because their businesses just can't afford it. This is a challenge we have as a nation. Let's bring down healthcare costs to get everyone in.
Senator, have you heard this in your community and your constituency? The businesses cooperating, employees still feeling secure in their workplace?
I think it's a real mixed bag. I was saying earlier, I spoke today at a convening of women small business owners, of the statewide convening of NABO, National Association of Women Business Owners. And we did an exercise where a series of questions were posted on screen and the business owners could kind of vote and express their concern. And I did this last year. There was a question about the Affordable Care Act, and what came up was a lot of fear and fear of the unknown, and they had limited information about how it would impact their businesses. This year, they questioned kind of the rollout, and I think it's still based on fear and a lack of information. I think there's been a real mixed bag. You know, the legislature has taken a very strong stand in press conferences and pieces of legislation that have been introduced, really trying to send a strong signal to corporate America that we don't intend for them to change their internal policies, their hiring practices, their hours of employment to allow their employees to artificially qualify for these subsidy programs. That is not why it was designed, and corporate America has a responsibility to take care of their employees. That's our expectation. So I think it's been a real mixed bag. We do want to make sure that the core engine of the state's economy, the small businesses, are able to grow and flourish and continue to hire employees. So we've got to find that balance. But the legislature's been very clear about our expectations about big business in corporate America, and that practice is just unacceptable in our eyes.
Go ahead.
Well, I just want to note is that it's so important to remember that for the vast majority of Californians, the world hasn't changed. They have insurance through their job. They keep that. The vast majority of businesses, large businesses, offer insurance and will continue to do that. What we're doing, though, is for a small percentage, but it's still millions, giving them the chance to get affordable care. But we still have a system that is an employer-based healthcare system. We need to make sure that that stays vibrant and still works.
Well, here's something that's out there right now, kind of a new notion that the Affordable Care Act could actually be a boon to entrepreneurship. That there's people staying at dead-end jobs. They call it job lock. I guess there's like 11 million people out there that are affected by this dilemma. They stay in their jobs because they need the health care. Now that they have this flexibility and this choice, they can perhaps leave that dead-end job, allegedly, and go out and be entrepreneurs. We may have the next Steve Jobs out there making the decision to leave the job and get their own health care. What do you think of that notion?
Well, I think that there's truth in it. You know, that, I mean, I've certainly heard stories of people who, because of having pre-existing conditions, said, boy, the reason I've got to stay in my job is if I leave it, I will never be insured again. It's a great news that we're now at a place where having health insurance isn't contingent on where you work. You're going to get it as an American. That's a great place to be. Let's move and make sure employers do their job, but let's let employees and workers work where they want to work and provide good service because they want to be there. It's a great place to be.
All right, we're going to wrap this up. I'm just going to parting shots from both of you here on this. Let's look ahead 5, 10 years, 15 years, 20 years. Where's this going to take us? Where's the choice in the healthcare marketplace? Where are we going to be with this? Where do you hope it will be? Notwithstanding whether you call it glass half full, glass half empty. What do you project? What do you predict?
Well, I've got to start by saying before I look 5 years down the road, I'm looking 3 weeks down the road. And I want to make sure everyone watching this talks to their family.
One enrollee at a time.
Absolutely, one enrollee at a time. We got to get, because this is a building process. So that's one. Number two, when I look 5 years out, I really do look forward to looking back and saying, yeah, there were bumps along the way, but you know, we are now living in a more just nation. We're living in a nation now that takes for granted what was controversial. I mean, the idea that it's controversial that we would have health insurance for everybody, in some ways, I look forward to looking back 5 years from now and that boggling our mind, as opposed to what in some states in this nation, it's being fought over. In California, we're doing the right thing. We're implementing this to give everyone health insurance. I look forward to 5 years from now saying, that was controversial? That's my goal.
Senator, what's your response on that as a final shot? As a lawmaker, but also as a mom, also
Right.
as a consumer.
Right.
What do you say?
And as a health advocate most of my career. First of all, I would say this has created a wonderful opportunity for me to be a part of coalition building that otherwise I may not have, to reach out to a business in my district, the Baldwin Hills Crenshaw Mall, to partner with labor organizations and other nonprofit organizations and churches to create a satellite district office, a kiosk in the mall, where we have directly helped to enroll thousands of Angelenos. It's something I'm very proud of and will be proud of throughout the course of my public career. So the coalitions that have come together to have a meaningful conversation about access to healthcare services, I think is important. You know, secondly, I go back and I think about Mary, and we recognize that an unanticipated healthcare crisis is the #1 cause for filing bankruptcy. And so to create an opportunity where we are protecting people and protecting their net assets is really, really, I think, fundamentally important. Thirdly, when I think 5 years down the line, I think of all the incredible opportunities, the resources the Affordable Care Act will bring into the state, the 90% federal funding that we'll be able to ride on those coattails for a number of years, frees up critical, fragile state dollars to allow us to support Californians and other safety net programs and other critical services. And as a legislator, as a member of the Budget Committee, that's very, very important and meaningful for me. And again, to help create the culture shift. You know, there was a time when there was no publicly funded Cal State system or UC system or community college, where going to college was only for those who could afford it. There wasn't a state-funded system that guaranteed if you're a California resident, you can go to college. You know, public education, K through 12, wasn't quite so public. And so it never would occur to us to now have an education system that everyone couldn't access. So I'm looking forward to being a part of history where we create a culture shift around access to healthcare services. And I think the rollout of Covered California, the expansion of Medi-Cal, the implementation of what I affectionately refer to as Obamacare here in California is the first step in that long journey. And I will just be proud to have been a part of it.
Great. Thank you both for your foresight and your perspective and your insight on this. Peter Lee, the Executive Director of Covered California. Thank you, sir. Good luck with one enrollee at a time, your upcoming deadline.
Thank you.
Good luck here into the future, Senator. Thank you very much, and thank you for being a voice and an advocate for your constituency and for all of California as we move forward with Affordable Care Act and Covered California and healthcare for all here in the state. Thank you both. And thank you, everybody, for your emails. And we want to remind you folks, too, that this program will be archived right here on this website, on Senator Mitchell's website. So if you want to tell your friends, if you want to come back and review some of the issues that we discussed here, it'll be right here. Feel free to watch as often as you want. In the meantime, that wraps it up here with this program live from the state capitol in Sacramento. I'm Brian Green, and on behalf of Mr. Lee and Senator Mitchell, we thank you for joining us. Have a good night.